Hi everyone, welcome back for week 2 of Quality and Performance Management in Healthcare. This week we are talking about mechanics of change and transitioning to teams. Before we get started, just remember every week we have our quiz that's due Friday at 7:59. And remember that deadline is quite tight, so any quizzes submitted at 8:01, you automatically get that 10% late deduction. If you have problems completing the quiz on time or you're having technical difficulties, reach out to me sooner rather than later. That in mind, if you message me at 7:58 saying you have technical difficulties, at that point there's not much I can do. So try to get the quizzes done earlier rather than later, just to avoid any problems like that. In terms of content this week, so like I said, we're talking about mechanics of change. So realistically taking a process that's been utilized within a facility or intervention or a program and doing something different within the sphere of procedure. Now we're going to talk about how things can be better or they can be worse. We're also going to talk about how to really tip the scale so that that change is more successful. And then we're going to talk about transitioning to teams. So before, quality improvement was sometimes done in the sense of one person running around and doing evaluations. Now we like to look at it as a team endeavor. So what does that quality improvement team look like and how to go about doing things? All right, so let's start off by talking about the mechanics of change. So we're going to talk about change in a whole, kind of where we were, where we're heading in terms of team structure and work structure. And then we'll talk about kind of the things that you're going to encounter through the process of change. Now, this quote nicely summarizes what we're talking about this week in general. The quote, whereas change may be instituted by one individual, the most effective way to change and to keep that change in place is through teams. So it's very easy as an individual to formulate this plan of change, but without a group behind you, without a group to help implement these change practices, it's very hard to get that change to stick. Often what's seen is change is enacted or implemented in the workplace, and if you don't have a team to help really ground that change within the workforce, it's not going to stick around. You do need the buy-in from the rest of the staff when you're enacting or implementing that change, and really you need to show them that the change is for the benefit of both the facility and the patients that are attending. Now, when we think about change itself, change just simply means that it's a difference from what was happening before. So it can be for the better or for the worse. That's where, in terms of programs and kind of interventions, that's where evaluations come into play. Because before we enact a change, we can't be entirely certain it's going to be entirely for the better, or if there can be worse outcomes associated with that change. Now, quality principles help tip the scale of change towards the better. So by utilizing quality principles, we can kind of stack our hand so that when we look at the probability of whether that change is going to be better or worse, the probability shows that it's most likely going to be for the better if we follow these principles. Now remember, change is going away from the status quo. So when we talk about change, we have to understand what the status quo is. For anyone who's done program evaluation courses or any kind of work, you probably remember that anytime you go to evaluate a program or institute any type of change, you really have to understand the program that you're working with. Otherwise, you could be wasting a lot of time and resources. In that sense, what we have to do here is really understand the traditional view of working and getting into the mindset of someone who would develop a process before we arrived on scene. Now, some of the aspects of traditional work involve things like power structures from the top down. So meaning that the executive director or the CEO, they say something and then it kind of goes down the ladder in terms of the pyramid, right? They say something to their managers, the managers spread it to the supervisors tell the staff under them what exactly they're doing. This model works because it's expected that there is respect for authority. So when your supervisor says something, you're just going to do it, right? Out of the respect for them. You might have questions on how to do it, but you're not going to ask the why of doing it. It's also expected that you will sacrifice for the organization, and that can be in terms of time. I don't want to say the effort of work you put in, because you should be doing hard work there, but there's some form of sacrifice that you're willing to make for the organization and for its success. There's a view that people like to be taken care of. There's also a view that supervision or control is necessary. And so we really see this kind of glaring at us in terms of what's going on with remote work right now. And you see the traditional view of working kind of conflicting with where work is heading, where a lot of old school CEOs, old school managers want their employees back in the buildings for no other reason other than they need supervision, they need to be kept on track. This is that traditional view at work. The next one, postponement of gratification, is the norm. So you're just going to do something and then you might get a bonus at the very end of the year, but there's going to be nothing immediate. The next is work, right? So you come to work to do strictly that. You work hard, you do your 8 hours or 7.5 hours, and then you go home and all your leisure time is separate from work. The last component is the mode to implementing a process, or the mode to doing something, is one of being cautious, safe, and compliant. So you're not going to take any risks. You're going to do things in the safest manner, mostly in terms of fiscally. You're not going to take very many risks, and you're going to be compliant. You're not going to push back on anything. Now, when we look at the new beliefs about work, or this should say where work is headed, because this is a slow transition that we see kind of going on, especially now. We see that power is shared and not based on position. So what happens is the manager might have someone with more experience, or the supervisor is someone with more experience that can provide advice, but realistically that team, regardless of the position, when you come together, every voice holds the same amount of weight, right? You're not being told exactly what's going to happen with a project. You're going to come together and brainstorm. The next one is the outcome and the accomplishment is respected. So the team has a goal and we're trying to reach that goal. And so that's where our focus is. We're respecting kind of the process to get us there. We're not respecting the supervisor for the sake of them being the supervisor. We're respecting what we're doing and what we're being told because we want to accomplish the goal. The next is individual needs are important. So if we think back to what was said with the traditional views, where it's expected that you would sacrifice for the organization, here it's about individual needs. So if you need an extra 10 minutes to get up, walk away, and maybe that helps you with your brainstorming, so on and so forth, those things are okay in this new belief about work. The next one, and this one kind of goes together with the next one we'll talk about, so I'll group them together. So we have people prefer to be in control of themselves, and people can manage themselves. So again, the traditional way of doing things is you need a supervisor to keep you on task, kind of that taskmaster who's cracking the whip to make sure that you're getting your job done, you're doing it timely. Well, in the new beliefs about work, it's that people prefer to be in control of everything that's going on when it comes to their specific work outputs. So if we think about remote work, you don't have your supervisor standing over your desk asking you to get that report to them by the end of the day. You know your deadlines. You can time manage yourself. If that means that you can go to the kitchen and grab food and come back and still meet that deadline, it doesn't matter because you're still meeting that deadline. It's the output. Going back to the other component, outcome and accomplishment is respected, not just that authoritarian kind of piece. The next one, short-term reward is more important. So in this aspect, think about it in terms of getting praise for the work you're doing right away. So instead of not hearing anything when you do a good job, and then you just hope that you get a bonus at the end of like Christmas time, when you do something good up and beyond kind of your job description, let's say, the employer is going to be there to reward you for it, whether that's kind of like a monetary format, or if it's just praise and employee of the month put up in the hallway. So I've actually seen this in place, and it does work in the sense of employees that do well in extreme circumstances, they get a little bit of extra, and it motivates everyone to work a little bit harder. The next one, work can and should be satisfying. So you can even look at this in terms of, and I guess the best example would be, go and talk to, depending how old your parents are, go and talk to your parents about what they did for work. I say this because I've had this conversation with my own father where I asked him about, oh, you worked as a technician for I think it was 45 years. Did you like it? And his response, going right back to the traditional views about work, work was work. I went there, I came home at 5 o'clock, and then I had fun. Now we look at work as something that is satisfying, something that we enjoy doing, right? It's not so much that I'm going to go do something I don't enjoy. There's a little bit of meaning behind the work nowadays. And the last one, growth requires risk and mistakes are acceptable. So when we look at the old traditional views of things, if you made a mistake, there was punishment for it, right? You got written up or you got reprimanded. Now that new belief is mistakes are going to happen, and as long as the mistakes are made because you're trying to improve, it's okay, right? Now this is different from making the same mistake over and over and over and over again. That is not what this is saying. This is simply saying if you're trying to grow in some way, shape, or form in terms of improvement, whether it's to increase your quarterly profit or to make something more efficient, if you're enacting change, there is a level of risk involved. Mistakes can happen, and they're okay to make. Now, something that connects this section of the lecture to the next section of the lecture is this idea that quality of healthcare depends on the work of an interdisciplinary team. So healthcare is a bit of an anomaly in that there's so many different moving parts that one person just can't know it all. They don't know all the processes in and out just because there's so many different levels of specialization. It's no different than having an interdisciplinary team that takes care of a patient, right? You have the doctor, you have the nurse, you might have a psychologist attached to it. There might be a pharmacist also attached because there's all these different moving parts that require a high degree of specialization. Just in the same way, when we talk about quality of healthcare, we can link it back to what was said earlier. You have to understand what is going on before you can improve or evaluate anything. And now the best way to understand it is to bring together the specialists and have open communication so that everyone can brainstorm and move together as a team towards improved quality. First things first, what is a team? So a team is a group of people working together to achieve a common goal. Now, there are 3 essential criteria that make for a successful team. The first is a team that is small in size. A team that's small in size, so around 5 to 9 people, give or take, it enables regular face-to-face communication. So think of it in terms of, we can relate it in the sense of like a lecture session versus a tutorial, right? When you're in a very big lecture, think back to your first year, there might be 200-300 students in that lecture. The chance of you getting some one-on-one time with just your professor it's quite short, right? There's more students in the class than there are minutes in the lecture. When you go to the tutorial session, when you take the hundreds of students and it goes down to 30 to 40 students, maybe even less, you have more time to interact with the person leading the session and have your voice heard. In the same way with the teams, we don't want to make the team so big that a majority of the members don't have time to talk or communicate or share their viewpoint on something. Everyone in the team should have something to contribute to that team, and so we keep that team nice and small So everyone has that time to talk, and there's not really much overlap in the roles of that team, which I think we'll talk to a little bit more later on in this lecture. If not this lecture, I know it's for sure in another one. The next essential criteria is shared goals, right? Goal or goals. Now, this is very important because when you're on a team that's on a specific project with a very definite timeline, right? So there's not much wiggle room. You don't have time to argue about your priorities. Everyone must be on the same page. Everyone must have that shared goal. In most cases of quality improvement, we're looking to improve some sort of process. Now, a shared goal in this sense, like we can think of it in terms of the surgical room again, right? If we're looking to improve the process, there's many areas of improvement that we can tackle. We want to build a team that has the same priority in mind. So in our case, that might be, okay, we want to improve the time from patient check-in at registration desk to the time that they're on the table and ready for surgery. If everyone on the team is on board with that goal, we can work productively. If not, we may find ourselves in a situation where half the team is arguing to reduce that time from registration to on the table, and the other half of the team might be arguing about processes such as charting, right? So we want to make sure that everyone has that shared goal, shared focus. The last of the essential criteria is making the team interdisciplinary. So we talked about this already a little bit before. We want to bring members together that have different viewpoints and perspectives. So it doesn't do us much good if we sit down at a table and it's all surgeons, right? I'm sure there's something to draw from that, but we're also limiting our capacity by viewing the situation through one lens. If we now invite nurses to the table, if we invite someone from administration to the table, now we have all these different viewpoints on how to make a certain circumstance better. Surgeons might only look at it in terms of, okay, what's the best tool to use for this surgery, or what's the best process for doing the actual physical surgery. Nurses might be able to lend perspective on interactions with the patient themselves and how to best improve that process from registration all the way into the room. Whereas the administration might be able to give us viewpoints in terms of, okay, what does that patient go through at registration? Are the forms overly complicated? What exactly do we need to fill out, and what's redundant in the registration process? So in that way, we really need that interdisciplinary nature of the team. Now, we also have a list of criteria that contributes to the success of a team outside of those three core components. The first is that there are norms and rules of conduct that exist and are adhered to regarding the processes of the team. So what that means is when everyone comes to sit into the room and have their meeting, everyone knows what to expect. If these rules and norms aren't in place, the process for any sort of quality improvement is probably going to be even more inefficient than the problem you're trying to tackle. People may talk over one another, people will be showing up to meetings late, not bringing the proper documentation they need. When you set the norms and the rules and you set expectations for the other team members or the team in general, things tend to go more efficient. The second is when members disagree, they are willing to engage in respectful conflict resolution in a positive manner. This is probably one of the most important criteria because you're going to have disagreements as you move through any sort of quality improvement process. It doesn't do the team any good if members of the team are standing up and storming out of the room because they're not willing to engage in conflict resolution. We have to be able to settle disputes or disagreements in a professional and respectful manner because everyone's viewpoint is valid, and some of the best problem solving can tend to happen when there's conflict involved, right? People get passionate about certain ways things are done, and they're guaranteed to butt heads at some point. So we have to have members who aren't going to fly off the handle and run out of the room. We have to set those rules and codes of conduct. The third, I should say, our members identify and establish resources to use when required. So understanding what you need and when you need it. The fourth one, leadership is fluid and it's based on who has the best expertise in the current area of need, despite a formal leader being identified. So if you're in the role of of the quality manager, you're going to be seen as the leader of the group. Now, this, in the new way of the workforce, this is more so just a formality, because when you run the team, if it's an area you don't have expertise in, you probably don't want to be leading that discussion. You want to be able to pass the baton, so to speak, to the member at your interdisciplinary table who has the most expertise, because they can provide the most insight, they're the most knowledgeable. So your team needs to be comfortable in looking to different people at different times. The next one are mistakes are seen as learning opportunities and growth. So we talked about this previously when we talked about the new beliefs in the workplace. Mistakes are going to happen, right? One kind of statement I've heard that really stuck with me is nothing changes if nothing changes. And all that means is when you step outside of your comfort zone, that's when change is going to occur, right? There is that chance that a mistake will happen. Someone will misstep because they're outside of their comfort zone. They're not entirely sure of a new situation that arises, and there is a learning process associated with this. In this sense, we have to view mistakes as learning opportunities and ways to do things better the next time, rather than use it as kind of a moment of punishment. The last one, there's clear basic roles and work assignments that are distinguished for each team member, as well as backup responsibilities for other team members. So everyone has to have a clear idea of what they're doing and what they bring to the table. If I don't know what I'm doing in a specific environment, nothing's probably going to get done on my end. And I'm sure we've all been in these kind of circumstances where you show up to work, no one tells you what you're doing, and you end up just kind of sitting there trying to look busy, and really you're not contributing to anything. The best way to avoid that is by establishing these clear roles and work assignments, as well as having a backup for other team members, so that if they're out sick or they're away for some reason, there's someone to still do that role. So now we're going to switch gears just a little bit and talk about components of the communication process. So like I said, communication is a clear component to the success of any kind of quality improvement initiative or change initiative. And there is kind of this distinguishable process of communication that occurs. The reason that we identify this is because there are points in the communication process that can break down, that can make things a little bit more difficult. And so if we can identify where in the process this mistake is going on, it's easily rectifiable. So now the first component of that is the sender. So it's the person with that message to deliver. So they must consider who they're sending that message to, the purpose of the message, the size and the length of the message. So if we think about an email, or I should say if we think about the message, is it better off put in an email? Or is it so long that we might just walk over to that person's office and speak with them? And we see this reflected in other components. And the other one is the ability of the message to get attention. So this last part is also crucial, because if you have something to say or get across to someone, but it doesn't necessarily bode well for, like, it's not going to garnish a lot of attention because it might be low on the priority list, that's also going to affect how you send it. The next stage is the filter. So it's something placed between the source of the message or the sender and the receiver, whoever is getting that message themselves. Okay, so it can be a physical boundary, right? So it can be like office walls, it can be distance, location, something like that. It can be how, like, the medium in which you're sending the message, right? And I'm thinking in this way, if you write a note and you pass it off to someone, or it can be a cognitive one. So something like a stereotype or a bias, which will influence the way that we receive messages as well. Think of it in terms of whenever someone said something to you and you might have gotten a little bit offended at it, and then when you said, hey, I didn't like that, they kind of backpedal and say, no, I didn't mean it like that. That's because there is a cognitive dissonance between what someone is saying and how you're interpreting it. That would be considered kind of a filter. The next is the message. So what exactly you're sending to that person, right? This is also crucial because this is how you're going to construct in language exactly what you want to say and kind of the format, that you want to say it in, and then this is what's going to get sent. It's then going to go through another filter. So after it goes through that other filter, that communication process then gets to the receiver, the intended target. Now, this intended target is then going to listen to the content of the message and they're going to absorb it. All right, so this is also crucial because, again, if we think back to biases and stereotypes, are they understanding the message that you sent through, right? Or is there something that broke down along the way that alters that message and how they've heard it? Think of that game when you're in grade school that they play, I think it's called Broken Telephone, where you have like 20 students line up, you tell the first student a message, they go through the whole process, and then you hear the message at the end and you see how warped it gets. That can tend to happen as well. Then what's going to happen after the receiver listens to that message and absorbs it, they're going to provide feedback. All right, so it can be positive. So in the terms of quality improvement, you can see agreement for your change process, or it can be negative in the form of disagreement. And this process can go back and forth a number of times. Now, depending on how your message is received, hopefully we get that agreement kind of green light, but sometimes we do get that red light of disagreement. Now, when there's disagreement, there's always the potential for conflict. There are two types of conflict in reality. There's negative conflict and then there's positive conflict. Negative conflict, so this results from no conflict resolution practices or policies in place. It ends up creating tension among team members and it can cause the team to stray from the objectives because they're distracted with whatever conflict is at hand, right? They can't let it go. There's infighting amongst the team members and they've basically lost sight of why they came together in the first place. The other is positive conflict. So this is when there is conflict resolution policies and practices in place. In this circumstance, team members remain level-headed. They're not getting distracted by fighting amongst each other and getting off topic. The essential conflict contributes to decision-making and problem-solving, and it ends up bringing the team closer to their goal. So like I said previously, sometimes conflict can lead to some of the best solutions because you're nitpicking everything that's coming up and you're trying to see if there's holes in the processes. Again, that typically leads to conflict, and that conflict resolution in place allows team members to remain level-headed and bring everything they can to the table to try and find that solution. Now we'll look at this slide in kind of the perspective of two lenses. One will be through well-managed conflict, and the other will be through poorly managed conflict. When conflict is managed correctly in a positive manner, what you get is three benefits. You get listening, encouraging, and energizing. That's the result of that conflict. When the conflict is poorly managed, you're essentially getting the other one, right? You're getting closed-mindedness. The work that's being put out is discouraging. And at the end of the day, when you leave work, you're tired, you don't want to work on the project anymore, right? It's tiring. Now, when the conflict is well managed and listening occurs, this is what generates a development of diverse ideas and points of view. So again, that interdisciplinary team coming together, everyone listening to the solutions being proposed. Think of it in terms of a debate. When the debate is civil, both sides are listening, so you actually get to absorb all the information being presented. You can actually gain a broader understanding of the topic at hand or the problem at hand because you're also seeing it through the eyes of someone with a different specialty. On the other hand, if conflict is poorly managed and there's kind of a closed-mindedness going off, you're not absorbing any information, you're essentially just waiting for your turn to speak. Think about any kind of heated argument you've ever had with someone. Next time you get into a heated argument, think, am I actually listening to this person as they talk? Or am I just waiting for them to stop talking so that I can just get my point across? It's usually the latter, where you're waiting for that person to finish speaking. And in that kind of sense, you're not going to get anything productive out of that conflict, that debate or argument, because neither one is listening. And if neither one's listening, you can't come to an agreement. In well-managed conflict, the end result is encouraging. You're closer to the goal. You have more options and alternatives in regard to the final decision to that problem-solving bit, right? You're making progress. On the flip side, it's very discouraging when you engage in conflict and it's poorly managed, because just like I said, in a heated argument, you know that you've closed off your mind. You're not really hearing what the other person's saying. It's also very noticeable when others are doing it to you, because you might say a sentence to them and they might say something back to you that's completely off kilter and not even in the same realm of topic. Now, I'm sure everyone can relate when this happens. It's very discouraging because you feel like you're not being heard, right? You're not opening up to any sort of ideas. The team is not making progress, and it's almost like you're just kind of dragging your feet through the mud. In terms of that last benefit, in well-managed conflict, the end result, again, it's energizing, right? There's that positive energy of good conversation, you're making progress, and seeing that progress encourages the team to keep going, right? You're one step closer than you were yesterday, so it's easy to get up in the morning, go to work again to make another step closer to your goal. On the flip side, it's very tiring when conflict is poorly managed. You know you're going back into that same room to accomplish the same result of standing still, right? No one is listening to each other. It's a heated argument most of the time, and it can just be generally taxing on someone. And at this point, as soon as you start having that poorly managed conflict really bear a burden on the team, that's when you start to see the team start to disintegrate, for lack of a better term, and you actually get further away from your goal as opposed to getting closer to it. When it comes to conflict resolution and the positive view on conflict, there's four things, or I should say there's four lenses that you can view the conflict through to help put forth a positive view on conflict. Now, it should be noted, rather than go through kind of the positive and negative lens, the negative aspect of it is just the opposite of whatever we're saying for the positive view. So it's very easy to make that connection. So I'm going to avoid doing that for this slide. In any terms, so for a positive view on conflict, there's an openness about the conflict. So you're not pushing it under the rug, you're tackling the problem head on. It's easier to do when you have experience to know that the team does have a positive view on conflict, because there's no hesitancy to bring up that problem. The next is you want to tackle issues over personality, all right? So the conflict is about the issue at hand and not about the person who brought it up, right? So in our case, if there's a fictitious Jim character sitting at the table, Jim brings up a problem, and there's a conflict that ensues, you need to view it as though Jim's bringing up a problem that the team's to tackle. Jim is not bringing up a problem because he doesn't like me, right? Or it's just there's something I don't like about Jim, and Jim brought up the problem, so I don't like what Jim is saying, kind of thing. You have to recognize that it's about the issues at hand, not the personalities sitting at the table. The third is avoiding blame. So if you sit at a table and you just point fingers at other team members, you're not going to go very far, right? No one wants to take blame for a problem, so if you point the finger at, let's say, Jim, Jim's going to point the finger at Sarah, and it's going to go around the circle, and it's going to keep going. You're better off just avoiding this whole circle. It doesn't matter, because at the end of the day, the team is responsible as a whole for what goes on. And that being said, the team must come together to find a solution for anything that's gone on, right? And taking it back even further, remember that mistakes are opportunities for learning. Right? So there's no need to even be pointing fingers for why something went wrong or something didn't get done, right? View it as a learning opportunity, tackle it as a team, and then move toward a solution. This brings us to our fourth component of the positive view on conflict, and that's it's a team issue. So the team either succeeds or fails. You're never going to have one individual from the team succeed and the rest fail. It's an all or nothing kind of thing, and so the conflict must be settled as a team. Now, anytime change is involved, you're going to need to make decisions. And so what we come to is fundamental decision-making issues. So the first issue we really have is understanding of financial information. So by understanding financial information, having a little bit of financial literacy, we can assist our decision-making through risk versus benefit cost analysis, right? However, this requires an understanding of return on investment, cost, and the budget at hand. Without this information, it can be very hard to do any sort of risk versus benefit cost analysis, which should always be a component of most of your quality improvement initiatives. Sometimes this isn't required. For example, looking at quality improvement initiatives that focus on falls of residence, yes, I can technically do a cost versus benefit cost analysis in terms of ideas of like lawsuits, or a small amount of equipment I have to purchase, maybe something like hip protector pads and things like that. But generally, that's one of the few occasions that I would say where that risk versus benefit cost analysis probably isn't required. But on the most part, you are going to want to include some sort of risk versus benefit analysis. The next is data-driven decisions. So we've all heard about evidence-based practice, right? Evidence-based guidelines, best practice guidelines, sort of the same idea, where for confidence in the decisions you make, you want to A, understand the data, and B, make sure that those decisions are in line with the data that's been collected and analyzed, right? The next, systematic problem solving. So in this manner, a rational, repeatable decision can be made, and so this involves a process development. So think about the scientific method, right? When we come up with theories or hypotheses, those are often tested. Now, they're only testable if they can be repeated. That's why we have methodology sections in research papers. In the same way, you want to make sure that whatever decision you make is done in a repeatable manner. That way, if you are ever challenged and people don't believe you, even based on the data that you show them, you now have a process that you can give them and say, here, this is what I did, like point by point. You can go do the exact same thing and see if you came to the exact same conclusions. The mere fact that that exists is going to lend to the validity and reliability of your decision making, and a lot of the times that will be good enough. But every now and then, you might be called out on it. And by providing this kind of framework, someone can go through, repeat your results, and it can just emphasize why you made the decisions that you did. In terms of decision-making tools, like I said, for change to be enacted, you need to make decisions. To make decisions, sometimes we need a little bit of help. Now, decision-making tools can really lend to that repeatable process that we talked about last slide. In terms of decision-making tools, this is not an exhaustive list. There are many tools out there. These are the ones that the textbook recommends. I've personally used the 5 whys before. The other two, the 8D and is not, I have not used in practice, but they are appropriate tools to use in certain circumstances, which we will talk about as well. So the 8D, it reduces or eliminates the root cause of the problem, and it's based on the scientific method. The 5 whys assists in identification of underlying causes by asking sequential whys. So I've also heard this kind of called the 2-year-old strategy, where you know how a 2-year-old will ask you, well, why does this happen? You give them the answer and they say, but why? You give them another answer, but why? And it's always a but why afterwards. That's essentially what you're doing here. It may take a minimum of 5 questions, so 5 times of asking why before you get to an answer. Then you have the is not method, which focuses on true problems by asking what is and what is not the problem underlying something. Okay, so the 8D decision-making tool, like I said, I'm a little bit less familiar with this one specifically, but the textbook outlines it very well. Your first step is to prepare. So you're going to decide whether the situation requires a formal approach or not. Next, you're going to form a team. So you're going to select individuals who will participate in the problem resolution. The participants must have direct interest in the outcome. Then we're going to describe and we're going to identify and quantify the problem using all the indicators possible. All right, so if I kind of go back to the fall reduction, what indicators can I identify for fall reduction? What does the literature tell me I need to include, right? We settled on number of falls, we settled on antipsychotic medication use, and the last one we used was restraint use. So it's not always going to be kind of, I guess, what you could call common sense, but it will be informed potentially by the literature. Next, so isolate. So prevent the infiltration of the problem from the next process or customer. This won't always be possible because sometimes it's going to take time to go through this process. Like I said, in terms of that fall prevention program that we rolled out, while we didn't use this tool, there wouldn't have been an ability to isolate the next quote-unquote customer from engaging in this problem because it would take time to really assess the environment and start implementing kind of problem-solving behaviors, right? I can't just cut everyone off of their antipsychotic medication. I have to do it in a manner that requires strict evaluation. So you're not always going to be able to fully isolate, but you can start isolating specific things. Then we have cause identification. So we ask why to determine and understand the root cause. So it can be used in conjunction with the 5 whys, but doesn't necessarily have to be so. All right, step 6, we're going to test. So we're going to verify identified solutions, and this is really going to require proof that you've accounted for the risks. Then we have corrective action. So we're going to eliminate the root cause, and then we're going to verify effectiveness of the actions we took quantitatively. Right? We need tangible results to show proof of concept that it worked. Then third, we're going to go back and correct the defective product if it's something product specific. Step 8 is prevention. So we're going to modify policies, procedures, and systems to prevent that problem from ever occurring again. And then 9, recognition. So we're just going to recognize the success of the team. Think back to the new way of doing work. We want to recognize small victories kind of things. We're not going to do kind of a delayed gratification approach. We want to recognize that the team was successful. So with the 8D tool, there is a why and a when of when to use it and what specifically within the tool that we can use. So we don't actually have to use it fully. We can use bits and pieces. Now, if I'm 100% certain of the problem cause, I don't need to use the 8D process. I can skip it entirely. If I'm fairly certain of a problem cause, I can use just steps 5 and 6, right? I can test and implement. If there are several possible causes, I'm going to use step 2, 4, and 5, right? And these are going to help me identify the cause and then rectify it. If I haven't even thought about identifying a cause and I have nothing in mind, then there's potential for me to use the entire 8D process. Now, where you land along the spectrum is going to tell you if or how much of the 8D process you will need to utilize. The next tool we're going to talk about is the 5 whys. Like I said, this is one that I've specifically used. I found this to be very effective because it really makes you think about the problem and get down to the actual root cause of it. Basically, you're just going to keep asking why until you get to the core of the problem, until you can't ask why anymore, until it doesn't make sense. The general rule of thumb is to ask why at least 5 times. So even if you think that you have the answer at your 3rd time asking why, you can probably go a little bit deeper and just keep thinking on it. Sometimes you have to walk away and come back, but there's probably a little bit further you got to dig. So it focuses on 3 fundamental questions to start and then gets into the why. So what is wrong with what? Do you know why the problem occurs on this particular stage or service? And do you know why to test operational definition? You're going to do 5 whys basically for each of these. The process itself is very straightforward. First, you're going to describe the problem at hand. So this is something that you should already know is occurring. You're going to identify and outline why that problem occurred. And then basically all you're going to do is you're going to repeat this step until a clear answer materializes. So you're going to say, okay, why did this happen? So for example, why did this resident fall? Right? I can say, well, the resident fell because their dose of antipsychotic medication is too high. Well, why is their antipsychotic medication dose too high? It might be too high because they have erratic behavior. And because of the erratic and potentially violent behavior, the doctor decided to up their antipsychotic medication, which does happen in long-term care. Okay, well, why do they have erratic behavior? And for this one, I would probably have to do a little bit of digging, right? I might not know for myself. I might have to go talk to that resident. I might have to go take a look at their room to see if something's out of sorts or so on and so forth. And we'll make up something fictitious and we'll say, well, in this specific case, the resident claims that they lost their favorite pair of shoes and this has been going on for a month. Okay, well, why did they lose their favorite pair of shoes? Well, the resident next door keeps coming over and stealing them. Well, why do they keep stealing them? And so on and so forth until you get to a point in this problem-solving sequential sequence that you can actually enact an action, right? Because if I stopped after the third or the fourth why, I'm not going to actually tackle the root cause of the problem. That problem is going to keep materializing. In the example I just gave, if the resident lost their shoes and they're getting agitated and angry and it's being kind of misconstrued as violent behavior, which leads to the antipsychotic increase, if I just go and buy them a new pair of shoes that was similar to their favorite pair of shoes, well, the resident next door might keep coming over and start stealing those shoes. And then we just have a repeated cycle, which leads to increased antipsychotic medication and increased falls. So as I keep going down that list, I can find that root cause where everything originates from, and I can tackle it. Right, so that being said, I've enacted appropriate corrective actions. If problem is eliminated, the action stops here. So I've gone to the very root cause, right? And I'm going to document the steps I took. If the problem persists, I'm going to have to repeat the process if necessary, right? Like I said, if I just buy the resident new shoes and then in 2 months, I start seeing that pattern emerge again where they're falling a lot, I might have to go back, ask why. I'll get to that same step of, oh, well, the resident is agitated because their shoes are going missing. I'm going to keep asking why. Even if I don't have an answer, I might just have to dig a little harder until I find it. Okay, and the last tool that we're going to talk about is the is not, which is generally used to identify what is and what is not within the scope of being considered at a particular moment in time. So it's beneficial to use this tool at times where you're stuck in that problem-solving process. So maybe you started off with the 5 whys and you're stuck in that process. You can't figure out, you got stuck on the 3rd why. Maybe it's time to look at is not. One resource that's really good for outlining the is not is table 3.5 in your textbook. I'm not going to go into in too much detail here, so please refer to your textbook for that specific table. Okay, so now we're going to move to discussing the transition to teams. So creating that quality improvement team. Like we discussed regarding change is not an individual endeavor. You need a team behind you to help. You need multiple perspectives that can be brought to the table regarding a specific problem. And that's going to increase your chance of success. So the big question is, how do I make a team and how do I run a team? So putting individuals together to work toward a common goal creates groups, not teams. Transitioning to teams is time and energy consuming, and it often requires additional training. So we don't just want to take a bunch of people and put them in a room, not really think much about it, and say, okay, everyone fix this problem, right? We want to make sure that everyone brings something to the table, everyone works together, and they come together like pieces of a puzzle. Despite sounding like the creation of a team is rather simple and as easy as bringing together just a group of people, there is a great amount of work that is involved in the creation of the team. Who's going to fill what role, kind of who's going to jive with who on the team. It's kind of like creating that sports team to win the championship, right? There needs to be that chemistry in the team that everyone works well together. There's a lot of moving pieces that must be addressed when you're creating a team. There is 4 key elements to team formation. The first being shared goals among team members. Everyone's got to be in it for the same reason. They want to actively be seeking kind of that quality improvement initiative. The next is a reason for working in a team element. There has to be a legitimate reason for the creation of that team. Otherwise, if team members feel as if it's just a waste of time, you're not going to have the same level of engagement. There needs to be an interdependence among team members, and that kind of speaks towards that interdisciplinary nature of the team that you create. And then we have kind of linked with that the ability of team members to depend on one another due to the differing skill sets that are brought forth. So it's not enough to bring together an interdisciplinary team. They have to realize the need for the other members on the team, as well as be able to rely on them, right? And this kind of, sometimes this can speak to ego. If one member of the team thinks that they just know everything, well, they might not be well suited for the team that you're creating. You need someone who understands their skill set, the skill sets of others, and how everyone is necessary for that team to operate. Depending on at what stage the team is formed at, you're going to have different goals and objectives. So for example, a management committee, it's going to set policy for the organization. Usually it's assisted by a director or a manager of quality. And basically, this committee is going to provide overall direction and guidance to the organization for how things are done. Then you can have a steering committee, which assists in maintaining consistency within the organization. So instead of kind of looking for change all over the place, this is a committee that makes sure that things are done the way that they're supposed to be set out to be done. The members of the steering committee should not interact on a day-to-day basis. What we're looking at is really creating that interdisciplinary team to come together and form those conversations. So it includes team members such as legal, human resources, communications, development, and planning departments. So basically all the different departments you want a representative from on the steering committee. You then have divisional quality improvement. So this is a staff level team, and it guides and supports various local level teams, such as location and functional quality improvement teams and business quality teams. So it's not quite that frontline team, but it oversees a larger area, but is actually working at tangible quality improvement. You then have the actual quality improvement team itself, which is that frontline quality team that addresses the issues as they arise. So again, you want members from all departments, and they come together to address the day-to-day problems that are occurring within that organization, as opposed to kind of the overall vision of the organization, right? So really the ground frontline work. So as opposed to kind of going through every level of these teams and discussing the formation of them, a lot of the time in terms of quality improvement, we're only focused on that frontline quality improvement team. So that's exactly what we're going to focus on here. So you need at least 2 member roles to fill, and that is the chairperson or the leader of that quality improvement team and the quality improvement team administrator. So the chairperson, so this is someone who should be a well-respected person who understands and believes in quality systems. So you want someone that embodies kind of that quality improvement spirit. They're open-minded, objective, and results-oriented. So think back to kind of the conflict resolution and really motivating the team to move forward. You need someone who's open-minded and who will bring forth positive conflict resolution as conflict arises. So you want to avoid choosing either the quality manager or executives for this position, because there's a potential for conflict of interest or kind of organizational political implications that can arise from that, right? So you want to make sure that there's someone that's a little bit separate from management, but can still liaise with the management team easily. In terms of the quality improvement team administrator, so very similar to the leader in terms of characteristics needed, right? Realistically, those are characteristics that you would like to have for all of your team members, but especially important for these roles. So you need all that, plus they need to be good organizers. They have to have that organizing skill. So this is someone who's going to be in charge of things like agendas and minutes for meetings, as well as tackling supporting needs for the quality improvement team. Now, in this role, it may be required to have someone full-time just because the needs are so great or the support needed is very demanding. On top of this, what you should also have in terms of your quality improvement team, you should have a charter or a terms of reference. And what this does is it lists and it outlines the other positions that you would like to have along with the general members. The terms of reference or the charter is also going to say the roles and responsibilities. That way you have something tangible on paper, and so it can never come down to, well, I didn't know that was my role. This responsibility should be distributed equitably among the standard team members. So everyone should have their fair share of work to do. It shouldn't be piled all on one specific department or one representative. One of the most important facets of that quality improvement team is there should be avenues for information generated by this team to pass from the team to the rest of the organization. And this is usually done easily through things like meeting minutes, through data. And when I say data, I mean things like graphs or something visual that can be put out, for example, in hallways or in unit break rooms, or reports. So for example, one of the things I used to do when I was working quality and long-term care, we used to put meeting minutes up on a board in the main lobby that anyone could come and read, including resident families, staff, or residents themselves. And that was so that we were transparent with the quality improvement initiatives that we were putting out. I would also go around and in each unit, I put up like a cork board, and I would post their stats. Now these stats were typically more so for the nurses, so it was typically in an area where only the nurses could access them. And that's just for the sake of, you don't really necessarily want to be sharing some sensitive information that has to do with residents on the floor. So indicators that we had that I've talked about before, things like falls and antipsychotic medication use, those aren't things that I would put up in public spaces, but I still put it in like the unit break room so that the nurses can see what is going on and what we're looking at in terms of the quality improvement team. When it comes to the typical implementation steps of the formation of the quality improvement team, and then just your typical day-to-day operations, we have 9 steps in total. Our first is to conduct a first organizational meeting. At this organizational meeting, we'll have our invited members that are sitting at the table, and they're going to select a leader or a chairperson, right? Remember, if we go all the way back to the beginning of our lecture, we're looking at things through the lens of the new ways to view work. So while this person, this leader or chairperson, is being elected as a formal leader, we have to keep in mind that each team member at some time or point will take that mantle of leader once kind of the problems that are arising are in their area of expertise. Next, we're going to select an administrator, someone that we know has the organizational skills that can take minutes, help organize meetings, and do really the administrative stuff that's required for a quality improvement team to properly function. The fourth step is educating team members, so bringing everyone up to speed on kind of the problems that need to be tackled. There might be some initial additional training that needs to be implemented. So for example, some organizations like all the members on their quality improvement teams to have their white belts in Six Sigma. That's completely up to the organization what they decide. There is a benefit to having that training so that everyone's on the same page, especially when you start using kind of root cause analysis tools and templates. Once everyone's brought up to speed, it's time to agree on and write up a team charter in terms of reference. So have everyone very aware of the roles and responsibilities, make sure everyone's in agreement, and then put that on paper so it can be referred to. This is also beneficial because if you post this in kind of like a public domain, if there's a staff member, for example, with the long-term care home, if there was a nurse or a PSW that had an issue in a particular area, they could go to the person responsible for that area on the quality improvement team and really discuss with them what was going on, hash it out, and get kind of that face-to-face expertise. The next thing is assigning elements to the team. Basically, not roles and responsibilities, but tasks. You're assigning tasks at this point. Step 7 is optional. It's not always needed, but sometimes you're going to want to appoint subcommittees. These are for kind of particular areas of interest that have popped up that might be outside of the purview of the quality improvement team, or it just might be as simple as either a time constraint or something that doesn't need to involve all the other members. For example, you might have a nursing subcommittee where the person responsible for the nursing aspect in the quality improvement team leads a subcommittee to get a little bit more information on specific issues and to really engage with the staff to either run by potential solutions or to discuss upcoming ones. Like I said, this is an optional step and doesn't always need to happen. Step 8 is you're going to develop an implementation plan. So much like logic models, this is going to be a living document. This is something that's going to either grow or shrink or be altered based on the point in time you are at the facility. Sometimes issues are going to pop up and you're going to have to add to that implementation plan and reprioritize what needs to be done. The last step is holding routine meetings to monitor results and make necessary changes to ensure progress. So this goes back to step 8, where you're going to look at that implementation plan at your routine meetings and you're going to make alterations as needed. Okay, so the last thing we're going to talk about for today is the internal development of the team. So what I mean by this is when a group of people get together, there are 5 stages that these people are going to go through that really contribute to the development of the team. It's going to bring these people together in kind of that, if we use the puzzle analogy, we're bringing together people who are going to be shaped into those puzzle pieces who then create the full overall puzzle. Now this occurs every time the group comes together, but the speed of the process increases every occurrence. So this isn't talking about routine meetings, right? This is talking about the inception of the team, right? Because as problems arise, there may be periods in time where the quality improvement team isn't necessarily really needed and it's just kind of a maintenance phase. That team will dissolve and then later come back together. When that team comes back together, they will work through these 5 stages all over again, but as mentioned, we'll go through them quicker. Now, the other thing to keep in mind, because a team can be fluid, right? People will quit jobs all the time. You'll have new hires that come on all the time with different expertise. So the group may regress through these stages as new members join or leave, all right? The 5 stages, so we have stage 1, it goes forming, storming, norming, performing, and ending. So it kind of just rolls off the tongue, easy to remember. We'll go through these stages and kind of talk about what happens in each one. Okay, so our first step, or stage I should say, forming. So this is where people become acquainted with one another in the team, and what eventually happens is it's going to determine each person's place in the group and how each member will contribute to the success of the team, right? How are we going to meet the objectives? What can I contribute? It's also going to determine the relationships between members, right? So just like if you think about that sports team and the chemistry between the players, your quality improvement team is going to go through a similar kind of process. It's also going to help determine the goals of the group, right? Remember, we need shared goals and objectives. This first stage is where we determine those goals and objectives. At first, members may be hesitant to take the lead and they often want to be told what to do. And now this is the benefit of electing that leader or that chairperson, because in times where a natural leader is absent, right, we're right at the starting stage, there's no need for expertise in any area, that chairperson can take the lead. Typically in this stage, so we want to share expectations for the group, right? We're going to guide them towards, okay, what are our common goals? We're going to develop a mission statement. So that's the what and the how of the group. And we're going to identify group norms. All right, so how is the group going to operate moving forward? What are the roles and responsibilities? How we're going to come together. The goal of this stage is the acceptance of group members and commitment to the group and its success. That's it. So we just want people to say, yeah, this is the place for me, and I'm invested in this team. So the next stage is storming. So storming, because this is where conflicts begin to arise. So you start to get resistance and arguments as group members become more comfortable with the group and feeling that they can state their opinion. All right. It's also where the working relationships begin to develop amongst the team. So I'm sure we've all been there. Think about when you start a new job. Anyone who starts a new job at first is very quiet. They don't want to say anything because they don't want to be wrong. There's a whole bunch of, I guess, barriers to really being open and honest with this new environment. As that person sticks around for longer and longer, they feel more comfortable saying what they're thinking, right? At this point, this is stage 2. So this is where like real personalities emerge. This is where the conflicts are going to arise. And then you might see your attendance either dip or surge, depending, right? So think back to conflict resolution. If you have negative conflict resolution methods, you're going to see attendance start to dip, right? Because it's very discouraging, because it's very closed off and tiring, people are going to stop showing up to the meetings, right? When people stop showing up, or at least attending meetings, typically your tasks are going to be left undone. So we want to avoid this as much as we can. However, unfortunately, this is where the group can regress because you have people that are absent who you now have to replace, and then you're going to revert back to stage 1, right? The tasks at this stage, so you want to determine a conflict resolution process for the group, right? Preferably positive conflict resolution. You're also going to shuffle committee members if needed. So if people aren't showing up, you're going to replace them. Now at this stage, it could also be a fact if you're just meeting too much. So if needed, you can reduce meeting times as required to ensure that those meetings are productive. The goal of this stage is really to clarify the activities of the group, and we really want to once again emphasize that team cohesiveness, so avoiding that attendance dip and trying to manage the conflicts as best as possible. Stage 3 is norming, which is just we're establishing the group norms and the group now starts to function effectively, right? So we've gotten past all the initial headbutting, for lack of a better phrase. Roles have been made very clear. People are comfortable in their roles. Team identification is apparent, and now we're actually seeing progress being made, right? We have a little bit more energy to work off of. Attendance has now rebounded, and there's trust among the members, right? And this is increasing. The more success you have, the more trust develops. At this point, we can start inviting guests to meetings to gauge interest in what we're doing. We can present and receive feedback from stakeholders, whether it's like a patient or resident group. We can look at stakeholders in terms of like the board of directors or even just staff. We're also investigating alternative processes and methods of decision making. So we want to find the best processes for that group, or that team, I should say. Now, the goal of this step is gaining internal support and acquiring involvement from external sources. So we want that staff backing, but we also want to see what external sources are saying, like that patient or client group. At this point, we've reached stage 4, which is performing. So what we see now is that the team is at full capacity, they're working full steam ahead, and there's that shared leadership structure. So that chairperson isn't necessarily required to get the group going anymore. There's specific needs as the group progresses, and individual people are stepping up when needed to lead, using an analogy, to lead the ship where it needs to head. Team members are very familiar with their roles. They work cooperatively with one another, and they're committed to the team. So we're not seeing absences at meetings. Everyone's showing up, everyone's doing their work. At this stage, we're starting to do transition planning. So once we have our problem-solving project implemented, we're starting to think about putting it into a maintenance phase, having these change initiatives stick. We're re-examining the mission of the team, and we're evaluating progress to date. We're going to make necessary adjustments because now we've rolled out evaluations, we can see what's working and what's not. At this stage, what we're looking at ensuring that the team has pride in their work and their accomplishments. So it's identifying the progress that we've made, celebrating the progress that we've made. Even though we know that more work has to be done, we can still look back and say that we've done some good work so far. Now, stage 5, this is ending. So it's sometimes not included as a stage because it either signifies the team has either completed its task successfully, or dissolving, or simply changing, right? Teams are static, or not static, sorry. Teams are fluid. And so there is a process of always changing. And just like when in stage 2, we had to bring in a lot of new members, we reverted back to stage 1. That can happen once a team has accomplished its initial goal. It might not need the same roster on the team. That can change, sending it all the way back to stage 1. So, like I said, it can occur when a team is given a new set of goals, or if there's a significant amount of downtime. So something due to holidays or closures. So if we think about something like the COVID-19 pandemic, maybe a restaurant that was closed down for a long period of time, when everyone comes back after a year, they're going to start back at stage 1. They're not going to get back into it at stage 4. At this point, members also begin disassociating with the team and the project at hand because basically it's finished. It's done. There's nothing more to do. So that kind of chapter of the work career is put to the side and they're looking forward to the next thing. If the team is to continue, it may restart back at stage 1 under a new set of goals and constraints. At this point, overall, the task is complete. Hopefully we can say that it's a job well done. We can celebrate with the team and we can move on to the next cycle that's required. Okay, and that's it for week 2. As usual, I get my slides from Slides Go, so I'm always going to give credit to them. Just keep in mind, like I said, you have a quiz that's going to be due on Friday at 7:59. Please don't leave it to the last minute because, like I said, if you email me at 7:58 and you say you're having difficulties, the chances of me being able to answer that email at that time and change the deadline are probably slim to none. The sooner you do it, the better. So keep that in mind when you're planning your week. Any other problems or questions, please feel free to reach out over Canvas, and I can either answer the question right on the message, or we can figure out a time to meet using Google Meets. All right, and we will see you next week.